We are live.
Thank you everyone for joining us today to celebrate the achievements of the 2019 John M. Eisenberg Patient Safety and Quality Award winners. My name is Shantanu Agarwal and I'm the President and CEO of the National Quality Forum. This year we are celebrating our awardees at this special virtual ceremony webinar. Thank you also to all of those who submitted applications for this award last year. NQF and the Joint Commission have collaborated on this award for a number of years, but never did we contemplate having a virtual ceremony. Challenging times call for novel solutions. Our teams have worked hard to continue the legacy of this important award and highlight the accomplishments of this year's recipients. So first, I want to thank the NQF and Joint Commission team for their efforts and diligence. The 2019 Eisenberg Award winners in the individual, national, and local categories represent some of the best examples in the nation of how individuals and organizations are transforming care delivery to achieve a safer and a more effective system. The work of Dr. Schiff, HCA, and WellSpan Health highlights the value of innovation in healthcare to continuously improve the safety and quality of care. Nothing could be more critical given our current public health crisis. This is a very special and unique award that unites the quality community in recognizing the lasting contributions and influence of Dr. John Eisenberg to improving patient safety and quality. John was truly a giant with an enduring legacy in our field, and many on this webinar knew John personally. I am pleased to welcome John's family, his wife Dee Dee, his sons Billy and Mike's wife Kaylee. Thank you for being here to commemorate John's legacy. Later in the program, Dr. Greg Meyer, chair of the 2019 Eisenberg Jury Panel, will provide comments about John, from knowing him as a mentor, colleague, and most importantly, as a friend. So thank you again for joining us today for this special celebration. I would now like to introduce our keynote speaker, Dr. Thomas Keane. Dr. Keane is a senior advisor for the Office of the Deputy Secretary at the U.S. Department of Health and Human Services. He is involved in a number of crucial initiatives, such as the HHS response to COVID-19 and the department's work on evolving and improving the quality measurement enterprise. Dr. Keane, I'll turn it over to you.
Thanks, Shantanu. I'd like to welcome everybody to the 2019 Eisenberg Awards and would like to thank our hosts, the Joint Commission and the National Quality Forum. For the next 15 minutes, I'd like to recognize the U.S. healthcare quality community by talking about some of its accomplishments. I'd also like to talk about a vision of the future for the healthcare quality enterprise. I believe I'm slated to speak for close to 30 minutes, but that would represent a record for the most anyone has ever listened to me in my entire life, which currently stands at about 14 minutes. So I'll go for a reachable goal here of maybe 15 minutes. The Eisenberg Patient Safety and Quality Awards recognize those who have made a significant and long-lasting contribution to improving patient safety and healthcare quality. The award is named for Dr. John Eisenberg, Director of the U.S. Agency for Healthcare Quality and Research, who passed away in 2002 at the age of 55. He spent 30 years as a medical doctor working tirelessly to improve quality in healthcare delivery by advancing evidence-based practice and emphasizing collaboration among caregivers. He is known for the instrumental role he played in the creation of the National Guidelines Clearinghouse. He published over 150 articles in the peer-reviewed literature, mentored innumerable healthcare providers as an attending physician at Georgetown and Penn, and transformed the arena of healthcare quality policy while serving in a number of roles in the executive branch under Presidents Clinton and Bush. Known as John of Arc to his colleagues, he left a wonderful legacy and set an example for all of us to live by. Continuing Dr. Eisenberg's legacy today is the first honoree, Dr. Gordon Schiff. Dr. Schiff is a pioneer in the field of diagnostic error, which is emerging as one of the most impactful in advancing healthcare quality and patient safety. He spent 30 years treating the underserved population of Chicago at the Cook County Hospital, during which time he published 250 articles and book chapters. His research and vision have given rise to the emerging collection of entrepreneurial startups that consult payers, providers, and employers on minimizing diagnostic error. And as if his dedication to the field was not already evident, for the last 10 years he has worked at the Harvard hospitals, generously sharing his knowledge at one of the nation's preeminent teaching institutions. As a native Chicago and myself, like Dr. Gordon, I understand the sacrifice he is making in leaving a great sports city like Chicago to live in a sea of Patriots and Celtics fans. The second honoree today is HCA Healthcare, selected for its success in leveraging real-time data to reduce mortality from sepsis. The implementation of HCA's SPOT system required breakthroughs not only in data science, but also in care coordination, clinical protocol development, training, and logistics. The result, mortality from sepsis has decreased 23% year over year since its deployment. HCA has shown us the great potential of a robust clinical decision support system. The third honoree today is WellSpan Health of York, Pennsylvania. WellSpan developed a remote registered nurse specialty trained telemedicine monitoring bunker to provide real-time surveillance for early identification of sepsis. It is estimated that this innovative solution has saved more than 350 lives since its deployment in April 2018. As we compare the approaches to managing sepsis developed by HCA and WellSpan, we see that great innovators can beat many different paths to the same destination. Efforts like these have allowed the nation to make great strides in improving healthcare quality in the 20 years since the Institute of Medicine published To Err is Human. Central line-associated blood infections decreased by nearly 50% between 2008 and 2013. There's been a 25% reduction in nursing home patients on antipsychotics, a 38% reduction in bloodstream infections in ESRD patients, 840,000 fewer pressure ulcers among nursing home residents, and so on. Like football, quality improvement is a game of inches, and the efforts of the honorees, the NQF and the Joint Commission, and the people on this call continue to move the ball down the field. But there is still much work to be done. In 2016, the British Medical Journal suggested that medical error is the third leading cause of death in the US. Diagnostic errors are estimated to harm as many as 12 million Americans annually. The FDA estimates that there are more than 2 million adverse drug reactions in hospitalized patients annually. There are also persistent concerns that some of our efforts at quality improvement may be counterproductive. Studies have suggested that the hospital readmission reduction program may not be reducing readmissions as planned and may be causing an increase in mortality among Medicare beneficiaries as the marginal patient is inappropriately denied readmission. There is data to suggest that the hospital value-based purchasing program has affected a wealth transfer from resource-constrained hospitals to well-heeled hospitals without significantly increasing value. And the overall quality improvement enterprise can be very costly. Physician practices are estimated to spend $15.4 billion annually to report quality measures, while hospitals spend $39 billion annually on regulatory compliance. The COVID crisis has brought some of these challenges into stark relief. 82% of the nation's nursing homes were cited for infection prevention and control deficiencies between 2013 and 2017. Despite improvements, the current crisis has revealed that we have a long way to go. CMS appropriately suspended quality reporting requirements for U.S. healthcare providers early in this public health emergency, recognizing that provider resources would have to be directed to patient care and crisis mitigation. It is worth noting that despite this, we have not seen an unraveling of the quality of care delivery. It has left policymakers asking if, as currently constituted, the government's quality measurement and reporting system is giving providers and patients the best return on investment we can get. My colleagues in government and the private sector have long recognized that quality improvement measurement and reporting programs must themselves evolve and improve. Administrator Seema Verma has risen to the challenge. She advanced the Meaningful Measures Initiative, which has significantly reduced provider burden by eliminating outdated and topped-out measures. She's launched the MIPS Value Pathway to better align quality measures with actual physician clinical practice. Her agency continues to advance electronic clinical quality measures to reduce provider burden, and she's conceived of and advanced the CMS Patients Over Paperwork Initiative to reduce overall regulatory burden on U.S. healthcare providers. She recognized the importance of quality and the extraordinary work of her deputy, Kate Goodrich, by awarding Kate the CMS Employee of the Year shortly before she left. And while we at HHS were very sad to see Dr. Goodrich move on to new challenges in the private sector, we're very excited to see that the administrator was able to recruit Dr. Lee Fleischer, a distinguished physician scientist and renowned quality expert, as the new CCSQ head. Our colleagues outside of government are also rising to the challenge. NCQA is advancing electronic quality measure initiatives and is instantiating quality measurement for the newly flourishing field of telehealth. The NQF continues its vital role in improving the measure development and endorsement process. The Joint Commission has pioneered and advanced the virtual site visits so that its valuable activities can continue during the COVID pandemic. And AQUA, representing the QIOs, is retooling its effort to launch nursing home infection control initiatives during COVID. The truth is, the healthcare quality community is very mission-driven, and the nation is better off for it. Recognizing the potential of government efforts to improve quality in healthcare delivery, last June, the President issued Executive Order 13877, which, as part of broader quality and price transparency efforts, directed the Veterans Administration, Department of Defense, and HHS to align and reform the government's quality improvement and measurement activities. To meet this challenge, my boss, HHS Deputy Secretary Eric Hargan, convened a panel of experts from both the private sector and government to define reforms that would be most valuable in advancing and improving the federal quality enterprise. The result of this effort is the National Healthcare Quality Roadmap, which was released on May 15th and which documents a vision for the future. The reforms in the roadmap rest on three pillars: governance, data, and rationalization of measures. The roadmap makes a number of recommendations on governance, which was viewed as the most important aspect of reform. But the key feature and words to remember are private sector partnership. Drawing on lessons from the governance of financial reporting, in which the private sector financial accounting standards boards establishes standards that are later adopted by government, we believe that the quality measurement enterprise will be best governed by a partnership in which private sector stakeholders have early and equal say. We note that the FASB partners with, but is independent of, the financial regulator, the SEC. In quality measurement, there are at least 6 government agencies across multiple cabinet departments that currently regulate and enforce healthcare quality. The independence of the standard setting and convening function from the regulatory function can help drive effectiveness as long as the entity that carries it out is truly independent and informs all stages of quality standard development. We believe this governance model is the future of the federal quality measurement enterprise. The roadmap also makes a number of recommendations on data management, including alignment of systems, standard setting, and funding infrastructure, but the key recommendation is transparency. The government and private sector both have a wealth of data on healthcare quality and on how to improve healthcare quality. The data is more often than not siloed and inaccessible, even within government, to say nothing of being inaccessible to the public. A key undertaking of government will be to identify the most valuable data that the government holds and to share this data across agencies, with providers, and with the public. Of course, any such undertaking will require the strictest adherence to privacy standards and will take into account the interests of all parties involved in any data sharing contemplated. Finally, the roadmap makes a number of recommendations as to how to improve and rationalize the federal government's quality measures themselves. The watchword for this effort is focus. The participants in the Quality Summit frequently voiced their concern that we are trying to move too many footballs down the field at the same time. Perhaps it would be less costly and result in more achievement if we as a nation focused on a few areas where quality improvement could make the biggest difference. Infection control, maternal and infant mortality, and so on. There has been a proliferation of measures and quality improvement activities, not only because we want to get many things done, but also because we want to provide flexibility to providers. But maybe all providers at all times don't need to be measuring and reporting quality metrics. Maybe we can focus on high priorities and exempt, at least as far as the federal government is concerned, providers who do not have a role in advancing those priorities. We are beginning to explore this approach to quality measurement as we move forward. It has been a goal of the Deputy Secretary to reduce the burdens government imposes on providers. In addition to producing the quality roadmap, he has designed and advanced the reforms to Stark, anti-kickback, and HIPAA that are in the process of being finalized. And he is also administering the Provider Relief Fund, moving financial assistance to U.S. providers quickly to provide relief of the financial strains that are being borne during the current pandemic. It is our hope that these and other efforts will provide long-lasting benefits to the U.S. healthcare community. The COVID crisis has demonstrated that there are opportunities to reform the national quality enterprise, many of them urgent. With the continued efforts of organizations like the NQF, the Joint Commission, our awardees, and all of us assembled on this call, we in government believe that the challenge can be met. As a side note, any speech given by a government employee has to go through multiple layers of clearance, and it's worth mentioning that while 4 of my jokes got edited out, probably to everybody's benefit, nobody objected to the dig on the Boston sports fans. So apparently Patriots jokes clear the HHS quality standards. Thank you.
Thank you very much, Dr. Keane, for those comments and for really laying out a vision for what quality might look like through HHS. On your comments about the true mission-driven focus of quality improvement professionals, I couldn't agree more, and certainly thank you for highlighting that. It is now my pleasure to turn the virtual podium over to Dr. David Baker, Executive Vice President, Division of Healthcare Quality Evaluation at the Joint Commission, who will tell you more about John and the history of this important award.
Thanks, Shantanu. The John M. Eisenberg Patient Safety and Quality Awards were established in 2002 by the National Quality Forum and the Joint Commission in memory of Dr. John Eisenberg, the Director of the Agency for Healthcare Research and Quality. Many of you here had the pleasure of knowing and working with John. He played an integral role in building the NQF we know today as a member of the founding board of directors, and he was an impassioned advocate for healthcare quality improvement. These annual awards perpetuate John's enduring contributions as a healthcare and community leader. The awards recognize individuals and organizations that have made significant contributions to improving patient safety and healthcare quality. 3 awards are presented for individual achievement, local initiatives that result in measurable health impact, and projects that achieve national impact. This year, we received submissions demonstrating exciting, innovative, and successful work taking place across the country. In addition to those receiving awards today, many of the submissions, I think, will be future recipients of the Eisenberg Award. The passion to improve patient care that we observed in all the submissions was really inspiring, and we applaud all of the work that went into these. From these submissions, our Eisenberg Awards panel, chaired by Dr. Greg Meyer, selected 3 recipients, representing major contributions individually, locally, and nationally to receive this prestigious award. In the registration materials for this webinar, we provide a link to a brochure we created this year, Making Healthcare Better, celebrating the 2019 John M. Eisenberg Patient Safety and Quality Award winners. In the brochure, you'll find a profile on each of the award recipients, members of the 2019 awards panel, and previous award recipients since initiating the award in 2002. Also, the July issue of the Joint Commission Journal on Quality and Patient Safety features stories on each of the 2019 award winners. Now it's my pleasure to turn the podium over to Dr. Greg Meyer, representing the 2019 Eisenberg Award panel. Dr. Meyer knew John personally and will make a few remarks. I also want to thank Dr. Meyer for his years of service and his outstanding leadership as he rotates off the Eisenberg jury panel. Greg?
Thank you, David, and thank you all for taking time out of your busy days to celebrate us, celebrate with all of us here this afternoon. And a very special thank you to Dee Dee, Michael, to Billy, to the Eisenberg family for sharing your dad and husband with us, and for being part of this ongoing tradition to honor him and his work. As I reflect back on my time working on the Eisenberg Award panel, it goes all the way back to the very first year. And when I think about the common threads, I think that despite the fact that so much has changed this year, and my goodness, I wish we could all be together and enjoy reconnecting with old friends and meeting some new ones, there are things that haven't changed very much over that time. The first one is the incredible support from the Joint Commission and National Quality Forum. That from the very beginning, when this idea was first floated, and I can remember that well back in 2002 to the present day, the support of the 2 organizations has been unflagging, both for this award and even more importantly for improving healthcare quality and safety across our nation. A special thank you there to Mark Sharon, to Sharon Springer, to Sheila Aguilar, for really making this process move forward year on year and making our job as a selection committee easy. The second thing that hasn't changed is that we have much to be proud of, but there's still a lot more work to do. The truth is that we've made great strides in safety and quality, and I think that in many ways, John would look down and smile upon us. In other ways, he'd say, but not quite done yet. There's a lot of work to do, and indeed, we will all be fully employed, I think, in the future in this work. And the third thing that hasn't changed is our job on the selection committee is hard. It's difficult. And it's difficult because of the robust quality and safety improvement culture that has been built across this country. That each year we get a number of terrific submissions and have to make difficult decisions among them. And as I think about, how to go about that, I really again try to tap into my experiences of working closely with John Eisenberg as a mentor, as a colleague, and as a friend. The criteria I use in my head are relatively simple. The first one is this something that John would be proud of? And is it something that John would be excited about? We all know what that takes for those that worked with John closely. The first is it has to be evidence-based. The evidence has to be that this really works, and it has to be robust, and it has to be checked 2 or 3 times before we believe it. The second thing is the notion that it has to be something that is actionable, that management can take and put into action to make a difference for patients. It wasn't about publishing the paper and getting the p-value. It was about making a difference for the patients that we serve and the nation that we serve. The third thing always is it something that is clever, that uses technology or new thinking to try to move us forward? And the final thing is it something that would just get John excited. Now you can all imagine, for those that knew him well, his impish smile when he saw something that he just was delighted about. The other thing I've learned from John is it's really important to have a good team, and I've been blessed on the selection committee to have just that. Lisa Patton, Andy Wiesenthal, David Shaheen, Mary Greeley, Mark Bennett, and Carolyn Clancy have all been incredible help to me and to the committee in moving us forward in what are these difficult decisions. I am especially delighted that Carolyn Clancy, who took over from John as the director of AHRQ, is going to be my successor as the chair of the panel. I also know that John would be especially delighted with some of the recipients today. I can remember well when we first launched some of the patient safety initiatives at AHRQ with the first round of grantees. And one of the things that came in was this proposal from this guy out in Chicago named Schiff, who had this idea that we ought to be studying diagnostic error. And, you know, Gordy is our individual award recipient here today. So terrific. And Jonathan Perlin and his amazing team at HCA, the work that they've done over the years, this today recognizing their work on sepsis, but many of the other projects that they've done, which I think John and I both would trace back some of the threads of this work to discussions that John and I had when we were all working in government today as part of the Quality Interagency Coordinating Task Force, something that John had started and I think made a real difference in moving the quality and safety agenda forward. Finally, I would like to say that in many ways, it has been such an honor to be part of the Eisenberg Awards over the years. And, you know, although I feel that it is time to pass the baton on, and who could I better pass it to than Carolyn Clancy, I will certainly miss it. I'll miss it because of the direct connection it has with John. Shortly after John's death, Carolyn Clancy, Nancy Foster, and I wrote a piece to recognize John that appeared in Health Affairs. And in it, we were trying to think about, you know, how to capture what John had contributed. And in the end, you know, what we settled on was a quote that was stolen from the quote that describes Christopher Wren in the St. Paul's Cathedral in London, which he designed. And the quote is, "If you seek his monument, look around. If you seek his monument, look around." And when I look around the work that we've had a chance to review over the years on the Eisenberg selection panel, that which was selected and outstanding, and those that came close and are improving and hopefully developing that evidence base to be next year winners, what I do know is that is the monument that John built. And I know that he would look down and smile upon us today. Thank you all for being such wonderful, wonderful members of the Quality and Safety community, and a very special congratulations to this year's awards winners. Gordon Schiff, the individual achievement for his work on diagnostic error. HCA, the National Award for the Innovation of Patient Quality and Safety, working on sepsis and using technology. And WellSpan Health for their work in quality and safety at the local level, again, focusing on the incredible problem of sepsis. Thank you.
David, you're on mute.
Okay, we will try that again. Thanks, Greg. Now it's my pleasure to present the 2019 Eisenberg Award for Individual Achievement to Dr. Gordon Schiff. This is a special privilege for me because I've been a longstanding fan of Dr. Schiff. I came to know him through the Society of General Internal Medicine by hearing his insightful comments, and especially by his strong advocacy for vulnerable populations. I've greatly admired him as both a person and a researcher. His contributions to patient safety are extraordinary, both for their breadth and their innovativeness. Throughout his 40-year career, he's consistently broken new ground. Even though I know his work well, it still amazed me to read over all of his accomplishments compiled in one place for the submission for this award. Dr. Schiff has authored over 250 articles and book chapters. Many are regarded as foundational works on medication safety, health information, informatics safety, and diagnostic error. He also helped conceive the Diagnostic Error in Medicine Conference Series and co-chaired the early international meetings. Dr. Schiff was an invited expert and reviewer of the National Academy of Medicine report improving diagnosis in healthcare, and subsequently has been breaking new ground on communicating diagnostic uncertainty to patients, one of the report's recommendations. For 3 decades, Gordy led quality and safety projects at Cook County Hospital, serving Chicago's uninsured and underserved. Over the last 10 years, he's led innovative quality and safety research projects at the Brigham's Center for Patient Safety Research and Practice and the Harvard Center for Primary Care. Because of these major and lasting contributions, Dr. Schiff is well deserving to join the ranks of the prestigious recipients of this award. Congratulations, Gordy. I am sorry I cannot applaud in person, but I will give you my best virtual applause and ask everyone else to do the same. Okay, take it away.
Well, thank you. You know, Greg, David, your personal and kind remarks. We've really, we've crossed paths so many times in ways I wish I had the whole 5 minutes to thank you personally and the whole committee. I do want to spend my 5 minutes thanking and acknowledging 3 sets of people in this brief 5 minutes. So that's 1.5 minutes each. So I'm hardly going to do anybody justice or groups. First, I want to just thank my colleagues, my work team, my family and friends, starting with my wife, Marge, my co-conspirator for 50 years. When we were at Rush, we desegregated the obstetric ward under the imaginative name Concerned Rush Students, but that was back in the mid-70s. My kids and their partners, they're all 4 are actively caring for COVID patients. So painfully, we've had to isolate from them and our grandchildren, our 4 granddaughters. So many others, too numerous to name, at Cook County Hospital colleagues, and especially the county patients who taught me medicine and humility, the needs, the pressing needs we have to improve quality in our health system. Its errors were system errors and the need for advocacy, and especially learning about primary care and continuity relationships with patients. And then the past dozen years, it's even more than 10, hard to believe, since I've left Chicago, all the wonderful collaborators and projects, we're still having the magic and joy of researching and making change together. And I can't give you their names, but the RAs, the pharmacists, the informatics and statistics folks, project coordinators, and the people who brought me to Boston, David Bates, and supporting me, Russ Phillips. Multiple roles these people have played all at once, these different, helping us in medication safety and diagnosis, health IT, primary care improvement. We've been brainstorming, critiquing each other, and again, accomplishing some of the things that were mentioned. So the second, I want to thank John Eisenberg and the award committee and the nomination that was provided by Mark Graber, and all those who've come before me as linked on the chain who've won this award. As I described in the interview, I knew John Eisenberg briefly in the Society for Medical Decision Making, and we also share origins and motivation in 60s activism and civil rights, as well as the fact that John and his father, like my father, died at a young age of brain tumor. But John's optimism, his energy, his passion, and particularly his commitment to equity were palpable, and that's something I'm going to come back to shortly. So in 2004, propelled by a growing awareness of patient safety in general, Mark Graber and I had the idea to hold the first ever Diagnosis Error in Medicine conference. It was going to take place in October 2005. I just found this. I found these emails that had NYAS in the heading, which I thought each time I got it, it referred to the Neil Young Appreciation Society, which was a very important society of one of my musical heroes, but it turned out to be New York Academy of Sciences. And it turned out that that conference never happened. NYAS decided it wasn't worth funding. But 3 years later, there was an industrialist named Paul Mongerson, and he was upset about diagnostic errors he had personally suffered. So he had 9 of us in his social room in Naples, Florida, of the condominium where he lived. And that meeting of 9 people has now grown into these international conferences you heard mentioned. Literally thousands of clinicians and educators and researchers have attended over the past decade. I want to recall the theme of that first 9-person conference was diagnostic error. Is overconfidence the problem? And sort of like the Supreme Court, I think the vote on the answer was 8-1, with most agreeing yes, it was the problem, and me being the dissenting vote. When I concurred that the doctors needed better feedback and calibration and less arrogance, speaking as a primary care doctor, I felt doctors were more beleaguered and overwhelmed than overconfident. Now, fast forward to 2020, we're all feeling a bit overwhelmed by our current COVID situation and the rising infection rates and need for leadership and that John Eisenberg epitomized. But to quote the late historian Howard Zinn, Boston does produce some good things here, pessimism becomes a self-fulfilling prophecy. It reproduces itself by crippling our willingness to act. So is overconfidence the problem? I'd like to think we need more confidence in our ability to collectively work together to overcome this pandemic, and perhaps underconfidence is the problem. So we need to be working boldly, collectively, confidently in solidarity with our patients and colleagues and public health. And if we do, we can solve many problems. And I'll just cite or brag a little bit. Massachusetts now has the lowest infection rate, COVID infection rate in the US. Several days last week, there were only 1 or 2 deaths reported. The overall death rates are down 90%, positive test rates down 94%. It's in spite of doing many more tests. Indicators we should have confidence in. These are indicators that should give us confidence about what we can do together with collective actions. So that brings me to my third acknowledgement, which is George Floyd. George Floyd's life mattered, as sadly did his terrible death. Like me, he was 6'4", but unlike me, he was a great college, high school athlete. Yet his nickname was Gentle Giant. Like many of our Cook County patients, he had a rough life. He got into trouble. He served time in prison. But when he came out of prison, and I just learned this from reading a couple of days ago on Wikipedia, he came out of prison. He worked for Resurrection Houston, a Christian church ministry where he mentored young men. He helped his mother recuperate after a stroke, contributing to the quality of her care, I'm sure. He delivered meals and assisted other patients with the Angel by Nature Foundation, a charity founded by a rapper. Later, he became involved in a ministry that brought men from the 3rd Ward to Minnesota to a church program with drug rehabilitation and drug services. In March, he lost his security job when the restaurant was closed down by the COVID epidemic in March, and then in April, he contracted COVID-19 himself. He recovered in a few weeks, but we all know how the story ends. So I would like to posthumously share this award with George Floyd for all his good deeds that he would have continued had he not been struck down. I'd like to think John Eisenberg, a civil rights and disparities and anti-racism activist himself, would be happy in part to have this award in part a tribute to George Floyd and the many others who are helping improve quality of others' lives. Thank you again for this honor.
Dr. Schiff, thank you. We do have some more time, so if you would like a few minutes, that would be great. I don't know if you have your award that you could share the attendees. That would be
yes. I obviously this is a very awkward award ceremony, but here it is. David is on my screen to my left, so he's passing it over to me and I guess it's still got the shrink wrap. But this is a very special award. I guess if I can even be more taking liberties, this is something else I received today, and this is from my 5-year-old granddaughter. As I mentioned, we were isolating from them, although they live next door, and she made this dream catcher. So again, maybe all the pessimistic bad dreams we can catch with this dream catcher. I don't know if this is showing well in the video, but thank you, Sydney, for this, because today is my 70th birthday. So thanks for giving me that extra moment to share those.
Thanks so much, Gordy, for those great comments, and happy birthday.
Thanks.
And now I'm pleased to honor the recipient of the Eisenberg Award for Local Achievement, which recognizes innovation in patient safety and quality with a focus on affecting impact at the local community, organizational, or regional level. The local award focuses on original projects or initiatives involving successful system changes or interventions that make the environment of care safer or advocate on behalf of patients. It's my pleasure to present the 2019 Eisenberg Award for Local Achievement to WellSpan Health for their system-wide approach to early identification and intervention for patients with sepsis through an innovative combination of technology and trained medical staff. They accomplished this using a remote RN specialty trained telemonitoring that they call a bunker as a more efficient and replicable care model to provide real-time surveillance in most inpatient settings and emergency departments across multiple hospitals. Performance data showed that this system reduced mortality and placed WellSpan Health in the top decile of sepsis mortality at every hospital compared to peers nationally. And even more impressive, their largest hospital was in the top 1% of all hospitals. This is a tremendous accomplishment, and we're delighted to present this award to WellSpan Health. I invite everyone to give their virtual applause to WellSpan. And now accepting the award on behalf of WellSpan Healthcare is Dr. Stephen Valeris, Vice President of the Medicine Service Line. Congratulations, Stephen. We look forward to your comments.
Thank you, Dr. Baker. And as another Southsiders from Chicago, I'm happy to be here this afternoon and join you all. I'm honored to represent WellSpan Health on this webinar today. We are proud to receive the distinguished John M. Eisenberg Safety and Quality Award from the Joint Commission and the National Quality Forum. We're honored by your recognition of our innovative Central Alert team, and we are very proud of their work. Our Central Alert process pairs the latest technology with experienced clinical staff and workflows to continuously monitor patients across 5 WellSpan hospitals for signs of sepsis. The team collaborates with the bedside team when they see sepsis indicators in the patient's electronic health record, allowing doctors and nurses to assess whether the patient needs immediate life-saving treatment. That urgency is essential because sepsis can cause a patient's condition to deteriorate rapidly. As a result of the Central Alert team's process, we are recognizing sepsis earlier with time from alert to identification, validation, and initiation of treatment reduced from 67 minutes down to 12 minutes. And the percentage of WellSpan patients who receive both timely and effective sepsis care, as measured by the Surviving Sepsis Campaign bundle measures, is better than both state and national averages. On a typical day, this busy Central Alert team reaches out to caregivers about possible sepsis cases in 50 to 80 unique patients per day. During cold and flu season, that number easily exceeds 100 per day. During the pandemic, as our caregivers have been treating patients who are critically ill with COVID-19, the Central Alert team's work has been particularly important because these COVID patients have had to be placed in isolation. The Central Alert team offers an extra set of eyes on all WellSpan patients, monitoring remotely as test results and vital signs are entered into their health record. Approximately 15% of our patients with sepsis also were COVID positive. We estimate that our process of care has saved over 350 lives since the program began. We also saw improvement in other outcome and care measures, including length of stay, rehospitalization, and total cost of care. And the number of lives saved is not just a statistic. The lives we save are our neighbors, our friends, our families, our coworkers who go home to their families and friends in our neighborhoods and communities every evening. There are people like Tammy Sullivan and Desiree Miller. Tammy and Desiree live in very different communities served by WellSpan. Tammy is a nurse, Desiree is a high school custodian. They don't know each other, but they do share a few things in common. Both of these ladies are in their 30s. Both their moms with 13-year-old daughters. Both landed in a WellSpan hospital due to an abdominal infection, which ended up accelerating to severe sepsis. In each of these cases, the Central Alert team monitored them, saw the signs of sepsis, and notified their caregivers to consider administering life-saving antibiotics and other care interventions, which they did. Tammy credits the team with giving her the chance to celebrate her 49th birthday. She loves chocolate cake, and she had an extra big slice this year. Desiree was happy to go home and snuggle with her daughter and watch a Hallmark movie, which they particularly enjoy because of the happy endings. And they understand this year what a happy ending really is. There was definitely somebody watching out for me, Desiree told us. It was the WellSpan Central Alert Team. While we are excited about the Eisenberg Award and excited about the life-saving impact of this work, we are also highly motivated to apply our learning and experience to find the next Central Alert Team, the next and better way to deliver care to our patients and our community. Changing consumer expectations are driving the need for innovation in healthcare. Healthcare can no longer be about making simple adaptations to outdated clinical operating models. It's about reimagining every step of the journey to health. Imagine if we could predict risks and outcomes and engage treatment options in patients with healthcare issues such as diabetes or kidney disease, or predict other chronic conditions before these illnesses result in doctor visits or complications. Our Central Alert Team shows us what is possible, and we explore and ask ourselves, what if? At WellSpan, we are reimagining health, challenging ourselves to innovate, explore new ideas, and leverage partnerships and technology to create better, more affordable healthcare outcomes and deliver exceptional care. On behalf of our 20,000 team members at WellSpan, we thank you for this prestigious honor.
Stephen, thank you very much for those comments. And in particular, thank you for showing us how quality improvement and the data that we often use to drive it really is about specific people and the Hallmark movies that they watch with their kids. I really appreciate how much you humanize the work and the effort that you and the team put in. Thank you. The final honor of this year's Eisenberg Awards is the National Award for an original project or initiative involving successful system changes or interventions that make the environment of care safer, or that advocate on the patient's behalf. The focus of the project or initiative extends beyond local areas to achieve national impact. It is my pleasure to present the 2019 Eisenberg Award for National Achievement in HCA Healthcare. HCA is being recognized for their exceptional efforts and innovation, leveraging data in real time for early detection and treatment of sepsis to reduce mortality. Using data science to analyze sepsis development patterns across 164 hospitals, HCA developed what they called Sepsis Prediction and Optimization of Therapy strategy, or SPOT, an algorithm and workflow for early sepsis detection and treatment. With the addition of SPOT in 2018, there has been an overall greater improvement in sepsis mortality, approximately 23% year over year compared to 2017. HCA Healthcare's Sepsis Prediction and Optimization of Therapy is the world's largest continuously operating sepsis surveillance system. HCA Healthcare is commended for monitoring patient data in real time, helping clinicians move beyond intermittent assessment to save lives, resulting in raising the bar for survival of sepsis. This is crucial as mortality risk increases by 4 to 7% every hour of delayed diagnosis. Accepting the award on behalf of HCA Healthcare is Dr. Jonathan B. Perlin, President and Chief Medical Officer. John, I'll hand it over to you to hear more about your work.
Well, thank you, Shantanu, and virtually I will accept this award. Hello, everybody. On behalf of HCA Healthcare, our CEO, Sam Hazen, SPOT team, and 330,000 colleagues and affiliated physicians around the country, very much like to thank the National Quality Forum and the Joint Commission, not only for this recognition, but for the work you do every day to improve the quality and safety of healthcare. I also want to congratulate our fellow awardees, Dr. Gordy Schiff for your groundbreaking leadership in patient safety, and Dr. Stephen DeLaveras and your team at WellSpan, who like us are working to save lives through innovation in sepsis care. At HCA Healthcare, everything we do is driven by the opportunity to continually improve the quality of healthcare and patient safety. We're honored to have been selected for this prestigious award and for our work on SPOT, which, as Shantanu mentioned, is an acronym for Sepsis Prediction and Optimization of Therapy. This award is so meaningful at a variety of levels. I had the privilege of working with and knowing Dr. John Eisenberg, and we spent time together working on the Quality Interagency Council, which was formulated to respond to the seminal work that was produced with the Institute of Medicine's To Err is Human report. John taught us to question the assumption that bad outcomes were simply bad luck, and to take the naive view when looking at a problem by asking, what would a Martian think? Well, by doing that, our teams at HCA Healthcare put a fresh lens on sepsis by resolving a fundamental challenge for clinicians, becoming aware of every new data point at the moment it is created, and simultaneously acting on those data at the patient's bedside. With the privilege of 37 million annual patient encounters across 2,200 sites of care, we have the opportunity to leverage scaled data to accelerate discovery and improvement. We embrace the virtuous cycle implied by a learning health system in which the data flow from the patient to our data warehouse, where we use data science to provide decision support directly back to care providers at the patient's bedside. Rinse and repeat. Our clinical data warehouse helps us drive novel insights, not visible or intuitive to human cognition, in support of safe, effective, efficient, and compassionate care. As many of you know, sepsis is an overwhelming response to infection that turns the body's immune system against itself. In the absence of early detection, it can lead to tissue damage, organ failure, and death. Each year, nearly 270,000 Americans die from sepsis, making it more deadly than breast cancer, prostate cancer, and AIDS combined. The key to surviving sepsis is early recognition, as every hour of delayed diagnosis results in an increase of mortality of up to 8%. Patients are diagnosed with sepsis on the basis of signs and symptoms, often recognized too late to successfully intervene. Historically, best practices in sepsis detection relied on manually screening for those signs, often at shift change, leading to a lag between actual onset and initiation of treatment. Thus, the traditional stop severe sepsis approach is akin to a stop severe fire program that responds only when a fire is visibly raging. What we wanted was a smoke detector for sepsis. So SPOT continuously monitors data in the patient electronic record, sniffing out sepsis 6 hours earlier than even the very best clinicians. It reduces the lag time to treatment by listening in to data streams and alerting care teams at the first moment a patient presents patterns consistent with sepsis syndrome. So SPOT helped us improve upon already benchmark performance by accelerating both detection and treatment. And this has resulted in decreased length of stay in the ICU, reduced time on ventilators, and most importantly, increased survival rates, cumulatively saving over 8,000 lives. SPOT has now been successfully implemented in 173 acute care hospitals, which predicts replication outside of HCA Healthcare. Our medical centers range from small and modest community hospitals to complex tertiary and quaternary training institutions. And we're very proud that the patients we serve are more diverse than the US population at large. And in the aggregate, we're the largest provider of uncompensated Medicaid and Medicare services. The core algorithm and infrastructure that power SPOT are developed from and shareable as open source. As such, the original source code could be reproduced by any healthcare system. All of this suggests that the algorithm to trigger evidence-based workflows should generalize to other healthcare settings. One of the greatest lessons for us is that we can harvest the digital dividend accruing from use of electronic health records to save lives. Much has been written about the burden of electronic health records, and our clinicians tell us that meaningful decision support, like in detecting sepsis that they might have missed, is the very best reward for bearing that burden. In the words of one physician, it makes using the electronic health record worth it. Importantly, the foundation upon which SPOT was built is a platform, not a singular solution. As a prototype, SPOT is demonstrating our capacity of our information model to support a true learning health system. We see use cases to SPOT that are similar in the detection of general patient deterioration or very specific events like internal bleeding, such as postpartum hemorrhage. We're using the big data of scale to learn at speed, empowering our clinicians and other decision makers through AI-based technology to provide more reliable, more efficient, and more compassionate healthcare. Consequently, we have already leveraged this technology to battle COVID. On the national stage, we hope this award recognition highlights the need for national policy to support similar data science innovations to improve healthcare. In closing, we'd like to thank the Joint Commission and National Quality Forum leadership, particularly Drs. David Baker and Shantanu Agarwal, and the award judges led by our terrific colleague, Dr. Greg Meyer, for their most meaningful memorialization of Dr. John Eisenberg. I accept this award on behalf of colleagues on our national team, and I'd like to recognize some here in our audience today, Dr. Jeff Guy, who leads our care process design, Dr. Edmund Jackson, our Chief Data Science Officer, and Dr. Jane Engelbright, our Chief Nursing Executive. And on behalf of all colleagues across the HCA system, who at this very moment are caring for over 6,000 patients with COVID and many more patients with other needs. But most importantly, we accept this award on behalf of those patients whose lives we can save and improve. Together, we're most proud of what SPOT means to those patients. The opportunity to celebrate another birthday, the opportunity to ring in a new year, and maybe even the opportunity to welcome a grandchild. In short, the Eisenberg Award demonstrates our commitment to the mission of HCA Healthcare, that above all else, we are committed to the care and improvement of human life. Many thanks to the judges on the Eisenberg panel, it's again an extraordinary privilege to receive this year's National Innovation Award. Thank you so very, very much.
Thank you, John, and truly thank you for describing what really seems like an exceptional and amazing approach and system to sepsis care. Please all joining in the audience and here on the panel, join me in congratulating again all of the 2019 Eisenberg Award winners. Now, David and I wanted to make sure that this was a very special ceremony and that we closed it in a special way, even with our virtual nature. And so because it's virtual, there are things that you can do that you can't do live. So at the risk of some reputational and physical harm, I'm going to try to open this and toast together with David all of the award winners. I wish I could share what's inside. I promise it's not that expensive, so probably not that delicious. You're probably not missing much. Go. All right.
Very nice job.
A virtual pour for everybody. And so here's a toast on behalf of David and myself to your exceptional work and impact, and thank you for your devotion to improving the quality and safety of care delivered in your communities and across the country. Cheers.
Cheers. Congratulations to everybody.
And in a small plug for those of you listening at home who want to be like one of these award winners, we invite you to apply for the 2020 John Eisenberg Award. The submission period for applications will open the week of August 24th, quite soon. The application will be available on our respective Eisenberg websites, both from NQF and the Joint Commission. And as you might expect, we will be especially interested in initiatives with a special focus on COVID-19 and pandemic responses. Thank you all for joining us again today, and congratulations to all the awardees.